to the World International or World UNANI Day. Thank you so much. Over to Pawan Sharma.
Thank you. Thank you very much, sir. We would like to welcome all international experts, maybe from India, maybe from abroad. All are international experts, and we are fortunate enough, really. Thank you, thank you, thank you all UNANI experts. Happy UNANI Day to all. And I'm really grateful by having a friend like Mohsin Sahib. Grateful, grateful, grateful. No other word can be replaced by this word.
Thank you, and I thank all my, and I also thank all my colleagues who I just give them a call and they are ready to come on this platform. Thank you all.
Really, really. So I would like to request Mohsin Sahib to lead in this session, and means we are learners. Now I will be silent and Mohsin Sahib will be my leader. Welcome.
Thank you, Pawanji. Happy UNANI Day to all. As we all must be aware that in 2017, it was announced that the birth anniversary of Hakim Ajmal Khan will be celebrated as UNANI Day. So this is the 7th UNANI Day for all of us, and many more to come. Without wasting much time, I would like to invite Professor Dilek Klick from Heidelberg, Germany. I think she's here.
Hello.
Hello. Welcome.
Hello.
She will speak on Mizaj and epigenetics. Over to you.
Yes. Hallo, ich bin Professor Dilek Klick von Heidelberg, habe 2 Praxis hier. Ich studiere nebenbei als Weiterbildung, Fortbildung bei der Professorin Amina, wo wir auch in Belgien seit 2 Jahren Vorträge über wissenschaftliche Arbeiten haben. Ich habe dieses Jahr gestartet mit Epigenetik und Avicenna und seit einem Monat ungefähr und will auch Message bei Epigenetik Verständnis hinzufügen. Also ich lerne mit Kreuzern auch, wie man Message praktiziert bei der Psychotherapie, Psychologie, Psychoanalyse. Ich lerne auch Ganon Full TIBB bei Avicenna Medizin über Kreuzer. Und wie es am besten die Patienten aufnehmen würden. Ich habe mit Professorin Amina Atta für ein paar Tage Indien besucht. Hat mir sehr gut gefallen. Und von Tag für Tag lerne ich immer mehr dazu, über die indische Medizin auch. Und UNANI-Medizin. Ich wünsche Ihnen allen noch einen wunderschönen UNANI Day.
Claudia, you will translate or I have to tell? I think Claudia will translate.
Hello there. Hello,
I can also do that much. I'm teaching her in German, so I can also do that. But it is better you translate it.
Hey, can you hear me? Okay.
Yeah.
I had some technical problems this afternoon, so I hope. So as I understood Dilek right, can you please repeat your exact what you did before, what you're studying?
I'm starting. I have seit 2 Jahren wissenschaftliche Arbeit bei der Professorin Amina in Belgien, wo wir monatlich teilnehmen. Monatlich teilnehmen.
Let me translate it. Since 2 years, she's studying with Professor Amina, and she's monthly attending the scientific meetings of Amina. And I think I got it right that you, ich habe das richtig verstanden, dass du Epigenetics auch
Genau, seit 2023, seit einem Monat, 2 Monate.
Since 2 months, she's studying also epigenetics with Dr. Amina, and she's also very focused on the herbs and on the study of herbs in that field. Das habe ich richtig verstanden? Also mit Kräutern?
Genau.
Genau.
Epigenetics und Avicenna, und genau, wir wollen auch den Misage-Verständnis, daran arbeite ich halt noch, weil es erst angefangen hat.
And she wants to spread the understanding, the Avicennan understanding of Misage and the concept of Misage.
Genau, wie wir es in Psychotherapie, Psychologie oder sogar in Psychoanalyse zusammen kooperieren könnten. Bei meinem Bereich, ich bin Psychoanalytikerin und ich will das halt, wie es dem Patienten besser aufnehmen kann, wie es dem Patienten besser entgegenkommen kann, wie man das kombinieren kann, alles zusammen.
Okay, and she hopes in future to combine all these teachings of Avicenna and other Unani scholars in the fields of psychoanalysis, psychology, and psychotherapy. And she hopes to bring it all together. Right?
Wir waren vor kurzem mit Professorin Atta, auch in Indien.
Yes.
Haben wir uns das genau mal angeschaut und so. Ich bin ja erst seit 2 Monaten in dem Bereich. Und für viele geht es nur um Medizin, bei mir um Psychologie und Psychoanalyse. Und ich bin ja ganz anderer Bereich halt wie die Mediziner. Halt nicht anderer Bereich, ich bin halt die Psychologie-Studierte unter denen. Und wir hoffen dann, dass UNANI-Medizin wir das auch irgendwie auch in Psychologie weiterbringen können.
Okay, she luckily visited India some time ago together with Professor Amina, and she was very happy to see it, and she wants to bring together in future the field of Unani with psychology and psychotherapy, which is a kind of, in some teachings, a new field, which might open also in Germany. And she hopes that Unani medicine will be a proper medium of this.
Das war's eigentlich von mir. Und wünsche einen wunderschönen Unani Day.
Thank you, Claudia,
und ganz liebe Grüße aus Heidelberg.
Yes, and she's sending her regards and wishes to everybody from Heidelberg, Germany.
Thank you, Professor Dilek, for your wishes and your.
I'm sorry because my laryngitis is very bad, and I asked Claudia to translate.
Also,
and she's reading. Mohsin Bhai, Dilek is reading every day nearly 20 research articles. She's downloading Misaj. She's reading. She's comparing. And that's what, when Dr. Nafis Banu was explaining, she said, like, we read this research article yesterday. You know, because here, you know, psychosomatic, the insurance covers psychosomatic. So treatments. So Dilek is bringing the temperamental analysis of the humans with the temperamental analysis of the herbs and putting up together with the epigenetics on the next generation sequencing. So what we are doing is, when we have a blood sample, we cannot check the misage of the person, we just get the blood sample. So we go on to the both genomic analysis, phenotype and the genotypes. We look into the mutations, and then we look into the plant genomes, which inhibit the mutations and reverse the mutations. And Dilek is a part of this study where she is learning how to bring in parallel. I'm not saying like a cohesive pattern, but a parallel pattern where we can have a Unani physician in India without the knowledge of genomics or genetics, does the misage analysis and the blood sample, where we can look into the genomics, the phenotype, like how Dr. Nafis Banu is explaining, that's what we have done. And we compare both together. And we have an accuracy of 99%. I don't see the patient, I only get the sample. Dr. Gur gives me the temperamental analysis and Dilip gives me the temperamental analysis. 97% when I start discussing, they ask me, how do you bring in the 97% of comprehensive plant genomics to it? So probably that would be better. Mohsin bhai, I think my speech is also finished with that.
Thank you, Amina. Now I'd like to call Dr. Musarraf Ali from Integrated Medical Center, UK. Thank you very much for joining us, Dr. Ali.
Thank you.
To you. Please unmute yourself, Dr. Ali.
Thank you for inviting me, Mohsin. I mean, it was a short notice, no doubt, but then...
it was very short, sorry for that.
Overnight, but here you are. All I would like to say is that, first of all, to congratulate everybody on World UNANI Day, because Avicenna Hippocrates has been in my mind ever since I was a student, first year medicine, and you know, why, how I got interested in it is quite another story. But one thing that really, you know, when I established my clinic here in London, in central London, and during those days, you know, I had time to start writing books. So one particular event that really got me into thinking seriously about UNANI was my very last visit to Hakim Abdul Hamid's home there in Ahmednagar. And he, you know, he had broken his hip and I think difficulty in walking and all that. But somehow he went to his library and brought me 13 books in English. She's saying, so he told me one thing, that I think you're in their place in England, in London. Start writing books on Unani medicine. And here are some of the books that will help you. And I was touched, you know, he was frail in health. I was very, very touched. You know, years ago, I sort of trained under him a little bit. So, and then he heard me also speak at a conference on Safi when I picked up some of the ingredients and gave my example of, you know, of many research that I'd done on skin diseases. And he heard me. He says, you speak so fast, but you got the point through. You know, so I was very touched by those things. And I tell you, since then, I went more into finding out where the Hippocratic books were and all that. And fortunately, I had contacts with King Charles, and I asked him if he was going on a pilgrimage to Mount Athos in Greece, you know, where the Orthodox church headquarters are. And he asked the monks. I was so surprised when he came back and he said that his original books are all kept there. So when there was a fire in Alexandria, you know, all these books got, you know, Galen's books and many other books got burned. And then as Christianity started spreading, they were saying that diseases are caused by, you know, by God. And what Hippocrates was trying to say is that it's, you know, it's your entailing power, it's your conditions of living, etc., etc. So the books were then taken by the monks and hidden in Mount Athos. I was so keen in getting them translated, and you know, and trying to look, but fortunately the visit didn't take place. So when Prince Charles or King Charles was going to India, I made arrangements for him to go to Hamdardnagar. The entire officials set up, people who arranged the royal visit. They were so sort of confused that why is he going to Hamdardnagar? And the traffic was horrendous, getting late, but he still went all the way to meet Hakim Sahib. Hakim Sahib took his pulse and all that and started diagnosing, but there were a lot of journalists there, so it was cut short. So when he came back and I asked him about this visit, he says that it was the most incredible visit that he's ever had. And he's a living genius. I don't know how long he spoke. I didn't go with the royal team that time. And I tell you, so it was so impressive. So he started, because Hippocrates was established a European form of medicine to start with. So one of the things that we were talking about is to get all the old books in the library that were affected by termites and all sorts of things. Books were not in very good condition. And we wanted to laminate the whole of the books. We started raising some funds as well. But unfortunately, that project never went through because, of course, Hakim Sahib passed away and all that. But it would have been so nice to get all those books preserved. I know where the books are because the monks have told where the original copies are. But if by some man, if those copies were available for proper translation, and there have been so many translations, when you translate from one language to another. But even though, these are important things, but they're lying in a monastery, in their archive, not even a library. And that's something that I wish I had helped in to procure and create a museum so that you could see the very first copies. It would have been really good. But anyway, I'm coming next month, and most certainly invited me to speak. So hopefully we start a dialogue here. Maybe I could help in collecting all these material and things that are there. And I've read as much as I could, but there's a lot of knowledge which is out there. It's not been translated. As I said, I do say in my book and in my various books that the innate healing power in us is a magical discovery. And that's what my focus is. I ran top hours with the very top people in the world. And I didn't use the word UNANI. The understanding was that it was an ancient system of medicine, started off with Hippocrates, then went to different parts of the world. But I can tell you that there were so many ailments. I did stop the use of medicines in many cases. So many ailments can be cured using just the Hippocratic principles or Avicenna principles, And these were not small spas. They were like topmost spas in Italy. And then later on, I started something in Kerala, in Goa, in Oman, in other parts of Italy. And so the concept of spa, which is still available in Italian, spas in different places. And when I saw the different types of treatment, I said, oh my God, they have survived under different names, thalassotherapy, water therapy, mud therapy near Venice, when you go up to the Dolomiti Mountains, and saltwater treatment, there's that. they were all part of the same, they had the same principles, you know. So anyway, I'll also hope to speak to some of you at the conference on the 4th of March. And then I'm doing a seminar with the intention of trying to show how some of the Hippocratic principles of physical therapies or regimen therapy can be used in treatment of chronic pains. I've taken some other, strokes, different forms of paresis, and different forms disabilities. I think it's one area which needs some attention, and students can be taught these techniques, which I help to develop, of course, using the same principle that the body heals itself, even in disabilities, brain injuries. Just lay down the conditions and they just heal. And cerebral palsy, autism. And so this can be then hopefully introduced to the students. Not only will they have plenty of work, I'm sure, they don't always compete with each other, and the students are coming out all the time, and they could be, Panchkarma, we have these systems, different. UNANI somehow needs to focus so that these methods can be revived again. They're being used in Europe, in Eastern Europe, Croatia, and not so much in Greece. And most of the spas in Europe, they use Ayurvedic principles, and they call it ancient principles. They don't call it Hippocratic, all that, because as I said, medicine was suppressed, by religion. So anyway, hoping to see you soon. Thank you, Mohsin, and happy UNANI Day to all of you. It's a great system of medicine. I tell you, the secret behind my success is that.
Thank you. Thank you, Dr. Ali, and looking forward to see you at our Second World Unani Congress in Delhi. Now, I would like to invite Professor S.M. Arif Zaidi Saab to come on line. I think he's there. You have some, I think we can't hear your voice.
Just
No, there's a disturbance in your voice. Not very clear. I think, please unmute yourself. Please unmute.
Yeah, I hear myself. What will I do still?
I think you have some network issue.
Let's just a minute. I'm coming out.
Yeah, now you're
I was sitting in the basement.
You're audible now.
I was sitting in the basement. Okay, just a minute. Give me a few seconds. To adjust me somewhere. I was sitting in my clinic in the ground in the basement, so that was the problem. So, just a minute, Moses, sir.
Sure.
Mohsin bhai, where is Pawanji? Tell him don't keep any session on Saturday evening.
Yes, I also have to excuse myself. After some time, I have to go for a marriage also.
Pawanji, don't keep
Haji,
anything on Saturday, please. Next, this is the last Saturday, Mohsin Bhai, I'm coming. I can't.
this is Unani Day, World Unani Day came to Saturday, I don't know.
Yes.
Hello, Assalamualaikum, sir.
Then you should have it in the morning, not in the evening.
Sir, am I audible now?
Yes, you are. Yes, you are.
Oh, thank you very much for providing me an opportunity. Let me congratulate to my earlier speakers, Dr. Rafiz Banu, Dr. Paliwal, and Ali Saab also. And also thanks to Sharma Saab for organizing this wonderful webinar. I am delighted to have one and all present joining us on World Unani Day celebration. Thank you for the participation. The Unani Day, which is now International Day, many countries like Iran, UAE, South Africa, Sri Lanka, where there are various Unani medication colleges, have now started celebrating Unani Day in their countries. As we all know, Unani Day is dedicated to the birth anniversary of Hakim Ajmal Khan, celebrated as Unani Day every year. Hakim Ajmal Khan was a human, a versatile genius, an intensely committed person. He was a remarkable combination of honesty, high idealism, and professional skills. He was the pioneer of Unani medicine in modern India. As you know, the whole world is undergoing a rapid change in all spheres, as there is a degradation of healthy ecosystem. Nature and living beings are under stress for survival. The quality of life is falling due to climatic change and increasing pollution. Life expectancy is also falling. Maintaining the integrity of nature and human health is a big challenge. Every year, every other day, never health problems are coming into existence. Drug resistance is also developing. There are a number of side effects and complications too, resulting in a global shift towards herbal medicine, as these medicines are time tested. In the light of benefits of herbal or traditional medicine, many Asian, African, and South American countries have allied the development of dual system of medical care, in which individual can choose whether they avail traditional or Western treatment. The Unani system of medicine is one of the oldest systems of medicine, and the existence of this system till now itself is evidence of the validity of its principles. However, the essence of any science is progress based on a continuous quest for new knowledge through research, development, and never applications. So, Unani medicines too is not an exception. As Ali Saab is talking just now about the regimental therapy, I must tell you that regimental therapy is a well-defined procedure, well-defined therapy in the Unani system of medicines. And there are number of regimens like cupping, venesections, leeching, purgation, and so on. I am also practicing all these regimens and found a very, wonderful, marvelous results in a number of cases. As far as leeching is concerned, we are trying to apply leeches on a diabetic foot ulcers. I had presented a number of times yesterday also it began once. As far as joint pains are concerned, other arthritis are concerned, we are using cupping therapy that are marvelous treatment. So that's come under the heading of regimental therapy. You see that nowadays, it is my, I believe that 80% of people today depending upon herbal medication in some or other forms as a component of their primary health care. This is according to WHO data. The herbal medicine can potentially contribute to the advancement of healthcare. Many major challenges must be overcome prior to the successful integration of herbal remedies into mainstream medicine. Remembering the legend and visionary late Hakim Abdul Hamid Sahib on this occasion, and how with his great vision, he put forwarded the idea of bringing together the researchers of various medical systems and Unani system of medicine under one roof and established Majidiya Hospital along with several other institutions, including Jamia Hamdard. The system needs a fresh wave of innovations to play its requisite role in the newly emerging era of medical pluralism. We need to challenge assumptions, try to reinterpret meanings in modern scientific terms, and most importantly, dare to experiment to generate fresh evidence. Indeed, for the incorporation of safe and effective herbs into the medical system to become a reality, more researchers and doctors need to be trained. Experience-based claims from herbal medical doctors must be transformed into evidence-based claims and standardization also. Dear colleagues, we have passed through a tough time of COVID-19, which hit hard worldwide, and thereafter the shift toward the traditional way of treatment and using it as a precaution against the virus serves as a reminder about the importance of Unani system of medicine and various other alternative medicines. It is my firm belief that Unani medicine is capable of offering the right solution to various health challenges that the world is currently facing. I would like to conclude by thanking to the organizers, Professor Pawan Kumar, convener and host of AYUSH Samriddhi, my friend and mentor, Mohsin Delvi Sahib, with whom support my presence become possible in this program, and their team also for providing me an opportunity to present here. I wish everyone a successful, safe, and fruitful webinar. Thank you very much. Thank you, Mohsin Sahib. Thank you, Pawan Kumar Sahib. Thank you.
Thank you very much, sir. Excellent. Great vision.
Thank you, Zaidi Saab. And so nice of you to come online, though you're out of your house. Thank you very much. And before I invite Dr. Misbah-Uddin Azhar, I think I'll hand over the mic to Pawanji, because I also have to go out for a marriage and the family. So sorry to all of you that I'm not be able to attend this.
No.
Definitely.
Please join from mobile. Please join from mobile.
I'll try, because I'll be driving. So I'll be online, definitely, but I will not be able to comment something. Thank you very much to all the speakers who
Right, I'm also sitting in the car for better signal.
Yes, I can notice that. And thank you all to all the speakers who have come in. And I think Pawanji will now take over. And I'll like to invite Dr. Misbah-Uddin Azhar from RRIUM Aligarh.
Thank you, sir.
Welcome, Dr. Azhar.
Are you there, Dr. Azhar? I think he may have left for some time. I'd like to invite then Dr. Farah Naz. I think she's also just reconnecting. Dr. Farah Naz, can you unmute yourself?
Yes, sir. Sir, am I audible?
Yes, loud and clear.
Okay, thank you, sir. First of all, I would like to thank the organizers, Independent Research Ethics Society, for giving me this opportunity to, to share dice with these big names of Unani medicine. I think I am the youngest here amongst the speaker. So first of all, I would like to say that I haven't prepared any presentation, or I haven't prepared any topic for today's talk. I thought it's a Unani Day celebration, and we will present our viewpoints or our perspectives. So right now I'm working as a medical officer in Delhi government. So I would like to start with that. In Delhi government, we are we have a mandate to serve the people of Delhi, to provide them the better quality health care. So it is our vision to provide promotive, preventive, curative, and rehabilitative care to the people of Delhi by integrating AYUSH facilities and utilizing their potential for creating healthy society. So I would like to congratulate the organizer for organizing this webinar. It's a great thing that we have come together on this online format to celebrate Unani Day. In the morning, we had this big international conference that was organized by CCRM, and most of the people were there. And the theme this year, central government has given the theme of Unani medicine for public health. So taking or considering this theme, I would like to put forward my perspective. Though, see, the public health is not a new topic. It's well known in Unani medicine. Public health is like a community medicine. It talks about the prolongation of the life and promotion of the health and prevention of disease. And everything in Unani medicine, I believe, and we all know, it starts with the prevention of the disease. It is hifz ma taqaddam. We say hifz ma taqaddam. That means the prevention is before the cure. So we start with prevention. And Unani system of medicine is a comprehensive system of medicine that considers the individual as a whole. We consider the temperament of the individual, as rightly explained by Dr. Bano before me. So I'm not going into that. So just I would like to actually quote that the global report of WHO on traditional medicine and traditional and complementary medicine that was presented, that was given in 2019. It charts the growth of traditional and complementary medicines over the 6 WHO regions and 179 member states. So it said that 88% of all the member states of WHO are using traditional and complementary medicine, and it was really very proud moment that it said that 82 member states of the WHO are using Unani medicine in one or the other way, and they are very much. It was very much encouraging that they have agreed to include the traditional and complementary system of medicines in their national health services. So I would like to share that when I was in CCRM, I was appointed in one of the program, National Health Program, Swastrakshan program. It was given to CCRM for implementation of this program. We did what we did. We had these 12 centers all over India, the peripheral institutes of CCRM. So this program was implemented through these 12 institutes. And what we did, we had this mobile camps. The team of professional health professional, doctor and pharmacists and other attendants used to visit the nearby places where the healthcare facilities are not available. They used to go there. They used to conduct camps, and the outcome was really very wonderful, very remarkable. As I was coordinating this program, and we put the report before the ministry. So I'm trying to say that the integration of Unani medicine in public healthcare or primary healthcare has already been done and has already been validated. It's a successful model, and government has accepted this. And another program, National Health Program, that was running at that time when I was in CCRM, was National Program for Prevention and Control of Diabetes, Cancer, Stroke, these non-communicable diseases. It was done, of this program, and the same results were obtained in that program also. The program was very successful. So this model of integration is already accepted by India and also internationally. Now the thing is that we need to do intra-AYUSH collaboration or harmonization. This is my thought, that there is a need for intra-AYUSH collaboration. We have this thing that this system is this. We are actually in a rat race, that my system is better than your system is this, your system is that. But what we can do for better implementation of our pathies, or for better acceptance of our pathies amongst the general public, it is the responsibility of stakeholders of Unani medicines to come over this issue and to go for intra-AYUSH harmonization, because it is the requirement. By this way only we can move forward. We cannot say that you have this thing in your system, you have this thing in your system. No, we want integration, harmonization. So in Delhi government has adopted this approach of cafeteria approach. We call it a cafeteria approach. What we do, we set up AYUSH dispensaries like Ayurveda, homeopathy, Unani together with an existing Delhi government dispensary where allopathy treatment is already given. So we try to set up our dispensaries there so that patient will be given a choice, he will be given a choice that what system he wants to choose, what system he believes is the best system for him or her. So it is this approach that Delhi government has adopted, and this approach is also adopted by central government when they decided to set up the AYUSH health wellness centers together with allopathic units. So this is about the national health program, the integration of Unani medicine in national health program. Now I would like to share that I am from Tibia College, and today is the birth anniversary of Hakim Ajmal Khan, and we all know that every year on 11th February we celebrate Unani Day to pay tribute to the great legend of Unani medicine, Hakim Ajmal Khan. He was, a visionary. He realized at the time when nobody has this vision or nobody has this concept that what British government is doing to our traditional indigenous system of medicines, he had a vision. And he realized that this policy of British government to stop the practices of Indian system of medicines in country will hurt us in a long way. So he come up with this idea of setting up both Ayurveda and Unani system of medicine under one roof, and Tibia College was established, and we have completed 100 years. And I'm very proud that I'm from Tibia, and I'm sharing this platform for celebration of Hakim Ajmal Khan birth anniversary. So, and this is I want to say that it is the right time that we come out of the differences amongst the systems, and we come up with some plan of harmonization, of integration of Unani medicine and other systems, AYUSH systems, in the national health program. And we realized the dream of Hakim Ajmal Khan. Hakim Ajmal Khan not only worked for Unani system of medicine, he is equally respected in Ayurveda system of medicines, because he had a vision. He did several meetings with his colleagues, and he was like, these systems has to sustain, and these systems are the future of India. And this was the policy. So I'm very I'm thankful that he did this, and today, because of his college and his vision, we are here, we are sharing this platform, we are presenting our views. And the other thing, like in Delhi government, I would like to brief all the participants here and the audiences that in Delhi government we have at present 189 dispensaries, out of which 24 dispensaries are of Unani system of medicines, and it is our mandate to establish 2 Unani dispensaries each year. So with this aims and objectives, we are working for the development and promotion of Unani system of medicine in Delhi government. And I'm thankful to the government of Delhi that they are providing all the facilities and all the things, support, technical and financial support for development of Unani medicine in Delhi. And with this, I think I would like to conclude my talk, because this is what I want to share with the audiences and with the participants of this program. Thank you, sir.
Thank you, madam. Thank you very much for your excellent speech. Inspiring, no doubt. Inspiring and communicating the facts of the action plan. So thank you very much.
Thank you, sir.
I hope Dr. Misbahuddin Azhar Sahib is with us. Dr. Azhar. I would like to request now Dr. S. Nafis Banuji. Welcome, madam. Welcome. Swagam.
Thank you so much. Earlier, I have talked about wait a minute. I think I'll first share my screen.
Time maximum 10 minutes.
Yes, definitely. I will finish within the given time. I'm very punctual with the time. That is my plus point. Now I'll just slide check. Yes, I think you can see my presentation. Hello?
Yes.
Perfect.
Yeah, wait a minute. I think where's the first one? Let me go to the first one. Yes. Now, earlier presentation, I was talking about how to prevent disease. Here, I'll just focus on the modes of treatment which are going to be promising for us. See, we all know that herbal medicines are being prescribed to everyone, and each and everyone, even a quack, we can say quack because they don't have any degree. The family practitioners, they know much more about the herbs which they have been practicing, and the folk medicines, we have lots. Most of the people, even if you go to a family, they will say such and such medicine or herb is beneficial in jaundice, this is beneficial in stones, kidney stones, and such things. So here I'll be talking because we really do not consider our drug therapies according to the misage of the patient. Because my focus is mostly on the misage, and according to misage, the drug, the diet, the therapies, if all these things are planned, then I think we are going to get promising results. Because what exactly is happening in our institutions, in our practicing, like how we practice, we just if I am in a government institution, we have certain prescribed medicines. Say, we just have one medicine for arthritis, one for this, one for this. Now, that single medicine I have to give to all the patients of arthritis. Now, see, I think myself, I feel that I'm not doing justice to the pathy at this stage. So what happens is, at times I do say the patients, because we don't have medicines for you, can I write it for you? So if the patient says, no, I cannot buy, so then I have that limitations. I have to give that single medicine to all, whatever misage they are. Now, this background slide, this I have given because my topic was promising mode of therapy today. Hippocrates was the pioneer. We consider him. I've just said here. I will just talk about very important things. What Hippocrates has said here. The three boxes of clinical medicine, the observations, the history taking. These are very important for the diagnosis of the disease, the diagnosis of the misage. If I have not observed the patient, if I have not taken the history, I cannot come to a conclusion of his misage. And the left side, I have the humoral theory concept of Hippocrates, which I consider very important today for anything. I'll say the diagnosis of the disease, the diagnosis of the person, the diagnosis of the misage, diagnosis of the age. If I don't have any other things, I can just ask certain questions and come to a conclusion of his misage. And then finally, I can make a regimen for his diet, for his exercise, for his... I don't need to, even if I just observe a patient or a person, I can say at least 50% of his misage. So this is very important, because even in the conclusion, I will talk about this. This is my slide again. Here, the three very important things are Arkan, Mizaj, and Akhlaq. These are the basic, I will say, the pillars of Unani medicine. The rest four are the ones which are according to this. So if these three pillars are strong, the person will be healthy, strong. And if these three are anywhere like disordered or anything, then the whole thing, the whole body will be disturbed, or we can say a person will be sick. Now, this again, I'll be discussing only these three, the four basic elements or the four states of matter. These elements are present in different fluids. So I will call them the body fluids or the humors. So these four humors, they are formed out of the four states of matter or the four elements. They have certain qualities, and these qualities decide my behavior. These qualities, because if I am very angry, that is certain humor. If I am very calm and quiet, that is certain humor. So this is my final presentation, and this is according to the humors of my body or my body fluids. Okay, so this is a very important thing, like what Amina has already said, and the other presenter who were like, I don't remember the name, she was talking about mizaj and epigenetics. And this is very important, because I just thought, like, if I'm thinking of this, there are many more people who have gone beyond this, because I'm just only talking about the genotype and the phenotype. What Amina has said, I think I'll be interested to work with Amina, and that will be fruitful. Now, this is the temperament. I will call it mizaj, or it is the phenotype. The genotype, the phenotype. This is very important in diagnosing the mizaj of a person. Now, and this, coming to this, how do I diagnose a mizaj of the person? So these are all the observations and then the questions. What is exactly history taking is nothing but history taking is, or the clinical medicine, I can say this is nothing but coming to a conclusion of his mizaj or his temperament is exactly what is clinical medicine now. So this, we do this questioning to, actually we are talking about his mizaj, but we don't mention it. Even in our practice, daily practice, we don't talk about mizaj, and we are just giving medicines. Maybe we have observed a patient is fat, a patient is lean and thin. So some idea we have about his humoral makeup. Now, this is the mode of treatment. So here, why I have given this slide. See, here this is dietotherapy or the diet therapy. This is regimenal therapy, and this is pharmacotherapy and surgery. I'm not talking about surgery. See, this diet should be given according to the age of the person, according to the mizaj of the person, according to the season. Are we considering this? No, we are not. We just prescribe, say, if a diabetic person visits us, we just give a regimen to him. This you should eat, this you should not. This is what is done. Now, what is this regimenal therapies? This is ilaj vital. We have so many therapies for the patient. Are we considering the age of the patient, the season of the year, the disease of the person, or the mizaj of the person while giving these therapies? We just advise fermentation to all of the patients. So is it right to advise fermentation? Are we considering the mizaj of the patient? No, we are not. Then again, I said earlier, ilaj vidawa or the medicine therapy or the drug therapy, we have yet to consider the mizaj or the temperament of the patient for advising the treatments. We are yet very far away from the actual Unani system of medicine, what it used to be and where we are. That is why we are not getting any the promising results which we earlier used to get. Now, these are the medicines. I'm not going to talk this now. This is very important. All the medicines, we say some medicines are hot, some are cold, like I earlier discussed, like some fruits, they should not be eaten in winter, some fruits are eaten in the summer. If it is the opposite, we are going to be ill or we are going to be sick. So the drugs, we have spices, they are all hot, and we have many drugs which are cold or which are soothing. So we have to take this into consideration. Like say any patient with psychological patients, we have I'll talk about it. So we are not considering the mizaj of the patient while prescribing the treatment for the patient, that has to be considered. That is why we are not getting very promising results. Now coming to this is very important slide. What is food? What is drug? What is poison? So I am born with a misaj, and anything which is not contradicting my misaj will be suitable for me. Anything which is contradicting to a very extreme, that becomes poison to me. And anything which is something related to my misaj. So why I say misaj is very important, because whatever, even at times it happens, I've eaten something and that doesn't suit me, I go for food poisoning. So that is very important. Here again, now, the very really latest word is detoxification. What is this exactly? It is actually, I have accumulated in my body the toxins. And what are these toxins? These toxins can be through all those 6 essential factors, can be through the gaseous. So what are the therapies which are detoxifying? They are all the regimenal therapies which are available to us. Again, I'll say these therapies are again given to the patients considering their misaj. If they are not given according to their misaj, they will not be fruitful to the patient. And the patient may complain that after your hammam or after your riyazat or dalak, I had this problem develop. So we have to take this into consideration. And this is very important, because we have been hearing aromatherapy. What exactly was aromatherapy in the past? We have seen, we have read in the history books that patient, in the royals and the kings and other things, the Vaidyas and the Hakims, they used to give certain things to inhale. Someone is unconscious, they have given something to inhale. Someone is epileptic, they have given them something to inhale. So what is that exactly? We are we have taken this aromatherapy as something royal. Though what I feel is, if we go through this aromatherapy in a very scientific way, we can develop this into a emergency medicine. Like say if a patient is epileptic, I know where the cause is. I can give him or her a certain drug to inhale, like it was earlier, a case of syncope or a case of shock, a case of epilepsy. They were all given drugs to inhale. So the results were drastic, and we had, because earlier we did not have any ventilators or we did not have any such ICUs. So was it that the patients were not treated? They were all given the drugs by the nasal route or by the breathing or inhalation medicines. So my take-home message is exactly what I have spoken. See, evaluation of the misaj of the patient and corresponding. This line says the current misaj and what his misaj should be in a healthy state. So I should know both the misaj of the patient. Then I can give him a proper medicine. Recommendation of diet according to the misaj and age. What a child will eat, that, and what a young adult will eat and what an old person will eat. I have to advise accordingly. Then physical activity according to the occupation of the patient. Why do we ask for occupation? That is again to just assess his well-being or his cause of disease maybe is in the occupation. Then choice of ilaj with the peer according to the misaj of the patient. We are all lacking in this and we are not practicing it in our daily routine. And then lastly, aromatherapy to be developed as an emergency medicine, because we say we do not have anything for emergency. Are we going through our classical literature properly? I have seen treatment for eclampsia in our books. We have seen a treatment for eclampsia. So if the treatment was available in the past, why can we not have it today, or we should develop it? Thank you.
Thank you. Thank you very much, madam. Thank you very much. Very precisely you have short and briefed everything. Thank you. Thank you very much. Now I would like to request Professor Gajla Mullaji. Gajala Madam. Professor Gajala Madam.
Yes, sir.
Welcome, madam. Welcome.
Uh, Thank you, sir. At the outset, I thank yourself and the Samriddhi, AYUSH Samriddhi and Dr. Mohsin Sahab. Again, this is my second, you can say, participation in your webinar. And I'm very much delighted that I'm be a part of this webinar. And so many learned people I have heard. Uh, the topic is UNANI System of Medicine for Public Health. So as per the topic, when we talk about public health, it is observed that whenever we are doing practice, whether we are doing, I'm not going to give any PowerPoint presentation because Mohsin Saab said me that we have to give a talk for 10 minutes. So I just want to highlight few things regarding public health. So in any practitioner, whether they are Ayurveda, Unani, Siddha, or modern therapy people, when any physician, you can say, seeing the patient, we can observe that so many patients, they are having respiratory symptoms. Either they are suffering from asthma, dyspnea, COPD. Some people, most of the people, they are, you can say, having obesity issues, and some children, they are malnourished. Am I audible? And then the people in post-COVID era, people are having issues with their sleep. They are having insomnia. Then they are having anxiety. They are having stress. They are having depression, losing job. And then this leads to stress. And then they may be having constipation or irritable bowel syndrome. So all these, you can say, complaint of the patient when they come to us. So it means that because of their faulty lifestyle or defective lifestyle, they are having so many health issues nowadays. So when we are talking about the common health, the Unani physician, they have already identified 6 essential factors that are necessary for maintenance of health. And as all are here Unani people, they know that that is Hawa, air, Makulo mushroom, that is food and drink, Harkato Sukune Badni, bodily movement and repose, Harkatan Sukune Nafsani, Ehtebaso Istifrag, and Nom Yagza. So even these 6 essential factors have been identified by WHO during the lockdown period, and the WHO head, he was stressing to, you can say, to lead a healthy lifestyle. So what as a Unani physician, what are our duty? That we should make awareness in the public that just by popping the medicine is not the solution. We should educate the people, and we should educate them about these importance of these essential factors. And when they are leading the healthy lifestyle, they can have a good health. Here I would like to, you can say, highlight one herbal medicine that has been, you can say, mentioned in classical Unani books, and it is very common, you can say, herb, which is very easily available. So if we, you can say, promote that particular herb, and that particular herb is also called as the miracle food, or it is also known as the, you can say, golden herb, and it is the moringa. So we should, you can say, educate the people, and we should educate the people about importance of moringa. So it is easily available, it is cost effective, ये बहुत सस्ती भी होती है, it is very cost effective. So if people start using this, so as most of the people, they are having stress, they are having anxiety issues, they are having depression. So if they are using this herb, this moringa powder, their anxiety issue can be relieved. It is useful for their bone health. It can be used as an anti-inflammatory property. It has got anti-inflammatory properties also, and it has got antibacterial property also. So with just a single herb, so many health benefits can be taken. So it is my, you can say, request to all the physician also. We should recommend this Moringa oleifera to our patient. And as Dr. Nafis Bano, I'm hearing about the Mizaj. I would like to say one thing that I have done a research on genetics, you can say, Mizaj and the correlation with the genetics. So I have done research, and for which Ministry of Ayush has funded for this project, and I have completed that project and I have submitted that project. And it is Mizaj is not just the phenotype. We are having, you can say, a genetic correlation with each type of Mizaj. So I would like to you can say, talk with Dr. Amina and Nafis Bano ma'am also, that how I have modified and validated the UNANI questionnaire, and then I have worked and genetically I have proved that there is of course a relation between the genetics and the Mizaj of any person. So my paper has been published, and I'll definitely share the my published paper and the genetic study of Mizaj with all these people. So with these few words, once again, I would like to thank the organizer. Thank you. Thank you very much.
Thank you. Thank you, madam. Thank you very much. Very flow, excellent flow. I would like to request Dr. Farjana madam. Welcome, madam. Are you with us? Dr. Farjana ji.
Pavanji, I don't see her there.
Now I would like to request you, maybe laryngitis, maybe laryngitis. No, I don't know. Please. A great voice is coming.
I don't know, like, when Dr. Nafis Bano and Dr. Ghazala, and we have, I think if we can have a discussion on a case study like Dr. Ghazala. She has worked for, I think, last 7 years or 8 years, she has worked on analysis of Mizaj. And Dr. Nafis Bano's experience, Dr. Nafis Bano's experience is almost 15 years.
Now I would like to request you to take charge of the session, madam.
No, I'm just asking Dr. Ghazala and Dr. Nafis Bano.
Yeah,
They both are there. I know.
Other speakers are also left.
So the question is, like, we are having the Mizaj, we are having the temperamental analysis. It's there in the books, it's there in the publications, but how to transfer that to the young students, if we can. I think Dr. Ghazala will also accept what I'm saying. The coming generation, they know Mizaj only as a Urdu word.
No. What I have done, Dr. Amina, the UNANI questionnaire was quite lengthy, and it takes time for a physician to, you can say, question to the patient or to the person, and then we will analyze the Mizaj. So what I have done with the help of data mining technique, we have reduced the questionnaire, and with that is the help from the IT sector I have taken. And then we have shortened, you can say, questionnaire, and then we have validated it. So if you are having a very comprehensive questionnaire, then it will become very easy for any UNANI physician, for any student, to assess the Mizaj of that person with the help of the questionnaire. Say, for example, in one of the you can say entity of the Ajnase Ashra is Shahem or Samin. That is the body fat and muscle. So if you just look at the phenotype, two physician can be different. One physician, as if, for example, you are looking at me, you will say that I'm just an overweight person. But say, for example, Nafis Bano ma'am say, no, you are obese. So how to, you can say, overcome this? So what I have done, I have taken the help of body composition analysis machine, which we get usually in the gym. Okay. And then that machine will give you the exact amount of muscle you are having on your lower limb, on your upper limb, on your trunk, and then it will also give us the exact percentage of fat in the body as well as subcutaneous fat. So when we know the percentage of fat, exact percentage of fat in any person, and in the exact percentage of muscle mass in any person, and then I have taken a WHO, you can say, table, which I'll share definitely with you, and that table will give you that in a if a person is obese, and if a person is of a particular age group, so how much should be the muscle mass in that person, and how much should be the percentage of fat in that person. And accordingly, then on that basis of that table, I have categorized the Sapravi Mizaj, Damvi Mizaj, Balgami Mizaj, and the melancholic. So what I have done in my research, I have assessed the Mizaj of the person with the Ajna Se Ashra and with the Sheldon somatotype. I have also taken the somatotype into my questionnaire. And then by doing the somatotype and uploading that data, and then analyzing the Mizaj of the person. And then I have sent the blood sample to the genetic lab, and where they have analysis the genotype of that particular Mizaj. So this is with the, I can say, with the help of the modern technology, with the genetic lab and with the, you can say, somatotype, and with the IT sector, we can definitely come to, you can say, a very consolidated questionnaire where we can construct a questionnaire. And then it will become very easy for the student also, or for any layman also, to assess the Mizaj. And once the Mizaj is assessed, then what is afterward? So by just knowing the Mizaj, you can lead a healthy lifestyle. You will come to know the proneness of the disease of that particular person. So he can lead a particular lifestyle so that he will not land into that particular disease, which as per his Mizaj he is prone to.
Dr. Ghazala.
Thank
I
you
think
very
Dr.
much,
Nafis,
madam.
Pavanji.
Claudia is left. Yours.
No, I'm like, this is too much for us to handle in a day, Dr. Nafis. I don't know, Claudia, this is too much to handle in a day.
Dr.
Dr.
Claudia.
Ghazala has inputs, Dr. Nafis. Claudia will also accept. Claudia, what do you think? Like, we are speaking about quantifying the techniques of identification of Mizaj. Did I put it?
Amina, sorry to interrupt you. I would like
Madam, we will have discussion after the speakers, please. Because four
yes,
speakers.
Yes. No, I'm here,
at present
sir.
also four speakers are.
Yes, please continue with the presentations.
And I'm taking a leave, sir. So kindly permit me to leave the meeting because I'm in Lucknow.
It's okay, Dr. Ghazala. Claudia and me and Pavanji are here, and Dr. Nafis will hold on for me. It's okay. It's okay. We can have another time. Claudia, the discussion, the discussion, Pavanji is also here. Is quantification of Mizaj with the available parameters, will that help, or is the human interference, like how we look into the concepts? I know, like, today is UNANI Day, it's a birthday of Hakim Ajmal Khan, but I was waiting till now, and Claudia was also waiting till now. Somebody speak of what Hakim Ajmal Khan gave to the world. He gave Ajmaline. He isolated a phytochemical, right? 100 years back. He went on to the molecular genomic analysis of Royal Fina serpentina to give us one compound called Ajmal. 3 compounds were isolated, and we got 3 compounds. And after 100 years, till now, we have no other quantification or qualification or nothing on the genomic DNA fingerprinting. This was a discussion I wanted to have. So, Claudia, what do you have to say? Most of the time, Amina is a critical analyst.
Sorry, I don't have anything to say to this point. As you know, I'm not a medical person.
Yes.
So if you allow me, I would continue with some
Whether
remarks.
we can get the answer from Hakim Rahul Aminji from Bangladesh, Are you here,
So,
sir?
Claudia, as a historian, Claudia, as an anthropologist, Claudia can give us and throw us a light on the ethnopharmacology, how it has evolved during this, and that would be a better one, right, Claudia?
No.
As a historian, as a historian.
I think I'm not qualified to say anything to this point. Sorry. You know that
Please go ahead with your presentation, Claudia.
I know I don't want to interfere to the. I think Dr. Azhar is first, right?
I am always anytime because I don't know what am I going to present. Seriously, Mohsin Delvi said, UNANI Day, please join. You can present, Claudia.
So, okay. I wanted to say some remarks on the motto on the poster of this day, UNANI as a unique system of healing. So why do I think that UNANI indeed is unique? To me, as a historian and somebody working on UNANI from the field of Islamic studies, it is quite important to look at the sources. For UNANI, the UNANI system, the sources are in the important languages of Greek, Latin, Arabic, Persian, and Urdu, some of which I'm able to read and to study. And so it means that UNANI has left many sources to us, even in books and in architecture. And it says that I think UNANI is unique because it comprises the knowledge of many countries and regions of the world. Meaning, as I said, ancient Europe, comprising the Greek and the Roman Empire, the ancient Arabic regions, Persia, and India, of course, as well. As of maybe final stage, India, meaning not only the state or present nation state of India, but also, of course, comprising the old Hindustan, meaning Bangladesh and Pakistan today also. So let me illustrate my thoughts also on the example of the hammam, which I have studied a lot. So it means, as I say, where are the sources from? And it is indeed unique that we have architectural remains of the hammam in ancient Italy, ancient Greece, and also in ancient, in our present Germany, where we have remains of baths of the hammam, which are concepted on the concept of the hammam as well. But what happened then? We Europeans, after the Middle Ages, forgot about the principles of the hammam, but the hammam went into the West and covering regions like the Arabic countries, the former Ottoman Empire and Persia, and of course, Hindustan. And we are now, we are at a stage that we are in the process of rediscovering even our ancient knowledge of hammam, especially through the Turkish migrants who have come to our country in the Western Europe since the 1960s as so-called Gastarbeiter, migrant workers or guest workers. They were bringing their infrastructure, the hammams also bringing to us, establishing hammams in many German cities as stages of Islamic culture and also of wellness, which is very important. I think it is also quite important to say that many things in UNANI medicine are our shared medical knowledge and our shared medical wisdom. And it is important for us also in Germany to rediscover our ancient wisdom, maybe with the help of Unani medicine. I think it is something Dr. Musharraf Ali has also stressed as well, when he said that the knowledge which is sleeping in the libraries have to be rediscovered. Yeah. So it is quite, yes, I am very, I see that Dr. Nafis Banu has written about the hammam in Bhopal, which I also have seen in person. But all in all, the hammam culture has unfortunately been forgotten, but re-established in some Indian cities as well. So I'm very happy about this development. Yeah. So, and it also says that the knowledge of Unani is unique. It is maybe sleeping in the books, and we have to rediscover it. And so I also perfectly agree with Dr. Musharraf Ali that we have to revive the books, and we have to preserve the books with the knowledge of all these famous scholars. And of course, it is one of the difficulties of a researcher like me to find all the books in a very rotten state. And it is hurting my heart as I'm today working in a library where the knowledge is preserved. Yes, to come to the conclusion, Unani is unique in many aspects. So from the richness of the heritage, from its heritage, and to the effects that so many influences from other countries have been also included in that knowledge. As I said, the Latin wisdom, the Arabic wisdom of Arabic scholars, of Persian scholars, and then coming to India, interacting with others, Indian systems of medicine. So I think it's really a unique example. And so I'm happy to celebrate the Unani Day with you all today, and happy Unani Day to everybody.
Thank you very much. Now I would like to request again Amina Tharji to control the session. Rais Khanji, Sheikh
Pawanji, I don't know, is anybody speaking? Like, I can be the last one. You can ask somebody to speak.
Yes, please.
Sorry. Only two of you, all three of you.
Please continue.
Can you ask somebody to speak? Then I can conclude at the end.
No, please conclude at the end.
Shall I conclude now?
Yes.
Okay, I'm just sharing my screen. I hope you can see. So we are speaking about 1 minute. Can you see the screen? Pawanji, can you see my screen?
Yes, clearly.
Okay, we are speaking about epigenetics. You can see everywhere we have epigenetics, and epigenetics, right? Everybody wants to get a genomic analysis for what to eat, what not to eat, and how it is. But when you look at the traditional systems way back from Ayurveda, from the Indus Valley civilization, I don't say it as Ayurveda, I say it as Indus Valley civilization or Arabian civilization or Mesopotamian civilization, we had the same concepts of identifying the temperament, the same things where we are looking forward for the world, how to identify what exactly the person is constituted, whether it is 3-element theory, 4-element theory, or the Chinese element theory. So you can look at every civilization. But now the technology has so advanced that we are not giving time for one person to one person consultation. So in this way, this was one point where, bring the nurture meets the nature. So bringing the genomes of the humans in combination with the genomes of the plant, and this is what is with the next generation sequencing. So the next generation sequencing, normally we take it with the EDT blood, 5 ml, 20 ml for different panels. And then it is centrifuge, sequenced, phenotype, genotype, what all is needed. We go right up to the code of the DNA. So these are here, the first column is the code, the second column is the variant and the mutation, and the third column is the disease or the syndrome. And the next column, what you see, is a particular plant genome which is needed. So for example, this report had mutation 12, mutation 10, mutation 11. So we pick up which is mutation here as per day. So if it is mutation 1, it is 100 grams. Then mutation 3 is 300 grams. So we bring it as a formulation for them for 3 months. And then the per week combination with the variants present. So this goes, and there are a set of recipes which have been tabulated. So this is what we have brought in here in Germany, a team of 3,000 experts all together under the European Medical Association chamber. I'm heading with the preventive healthcare, where you have a particular code which is mutated and a particular plant genome which inhibits or reverses the mutation. Here is a science and technology. On the other hand, India is rich with the personal technology, human to human interface. Like Dr. Nafis Bano, what she was speaking, the 6 essentials is enough even to prevent a surgery. 6 essentials are enough even to prevent a carcinoma when you know there is a hereditary carcinoma. So this is what I would like to put forward, and probably we need a 1 hour of session where it is only 2 persons discussing. It's not like somebody is coming with a presentation, bumping on everybody to hear and just move on. So I request you if something like that, and I would look forward to it. Is that okay? Now, Dr. Nafis, is that okay? She is giving a big leap.
No, this should be okay with the organizers as well.
Yes, that's what I'm asking them. Like, you know, we just have only 2 of them fighting like a debate, 2 and 4. So then only we can have a conclusion, you know, some critical review. It should be a 2 and 4, you know. Maybe somebody doesn't like
your
what
subject
I'm saying.
is unique, madam. Your subject is absolutely unique, and this will be a learning session for us also. I don't know what time is there in your Germany, but we would like to
I have
have.
3 guests waiting for me.
Pardon?
I have 3 guests in my place just now who arrived waiting for me. So it's 5:30. Pavanji, see, I am not speaking on taking care of the whole world. I'm always speaking, taking care of yourself first. Every session, I just said my brain will not take more than this. Stop. ये एक limit होता है खाने के लिए. You can eat 1 plate, 2 plate, 3 plate, 4 plate, 5 plate. We cannot go beyond that. So it's not my duty to take care of the whole world. It's my duty to take care of myself. When I take care of myself, automatically my family is relaxed. See, we are speaking, you know, when you know there are 23 people here or 30 people here, you know, just 1 point, 5 minutes is enough. जब चावल पकता है, एक ही दाना उठाते हैं ना हम लोग देखने के लिए कि पका है या नहीं पका है. We don't squeeze the whole thing. तो बिरयानी नहीं है, एक ही दाना उठाते हैं ना हम लोग. जब दम होता है चावल एक ही दाना, जब हम पूरा का पूरा खोदते हैं तो चावल नहीं रहता हो.
आज यूनानी डे के दिन मैडम मैं तो सोचता था कि आप लोग कुछ गाएंगे, आप लोग कुछ अच्छा बजाएंगे.
नहीं है, ये मुशायरा शायरी तो मोहसिन देलवी की कहानी है. तो जब मैं इंडिया होगी तो एक दिन करते हैं, ठीक है?
जय स्वागत है, स्वागत है, स्वागत.
If when I come to India, I hope I don't come back.
Rais Khan ji, welcome. Rais Khan ji, welcome.
जी अस्सलाम
Thank
सर.
you.
हाँ, मैं कुछ बात करना चाह रहा हूँ. लास्ट ईयर जब हम ये सेलिब्रेट कर रहे थे यूनानी मेडिसिन डे, आवाज क्लियर आ रही है?
हाँ हाँ.
तो उस वक्त ना पाकिस्तान में ग्रेजुएशन के लेवल पे 7 यूनिवर्सिटीज ऑफर कर रही थी 30 तो तिबिया कॉलेज है जो डिप्लोमा लेवल पे यूनानी मेडिसिन ऑफर कर रहे हैं। आज हम सेलिब्रेट करें तो 11 यूनिवर्सिटीज के अंदर BEMS या बैचलर ऑफ ईस्टर्न मेडिसिन एंड सर्जरी जो है यूनानी मेडिसिन की तालीम इस वक्त हो रही है। तो एक मतलब बिग अचीवमेंट है। हमदर्द ने स्टार्ट किया था पाकिस्तान में 2 अप्रैल 1995 को, और हम यूनानी मेडिसिन को ग्रेजुएशन लेवल बल्कि एमफिल और PhD लेवल 2 इयर्स हमारा एमफिल होता है ईस्टर्न मेडिसिन या यूनानी मेडिसिन में, और 3 इयर्स का PhD होता है। तो हम उस लेवल तक लेके जा रहे हैं इसको। और हमेशा मोहसिन देलवी साहब इस वक्त है नहीं, वो शादी में गए हैं, वरना जरूर मैं उनसे वो कहता कि इस फॉर्म पे जब भी हम आए तो पाकिस्तान में ईयर बाय ईयर बहुत चेंजेस आते जा रहे हैं, और हमदर्द जो है पायनियर है इन दैट फील्ड। तो बस यही मुझे कहना था, और आप सबको मुबारक हो। आप लोग तो बहुत ज्यादा इंडिया में मौके भी हैं, रिसर्च की फैसिलिटीज भी हैं। हमें यहाँ पे 0 लेवल से स्ट्रगल करना पड़ी, और अल्हम्दुलिल्लाह हम उसमें कामयाब है कि अब यूनिवर्सिटीज में हमारे ही स्टूडेंट जो है एज फैकल्टी मेंबर PhD लेवल के वो संभालते जा रहे हैं।
थैंक यू रईस खान जी फॉर द ज्वाइनिंग, एंड आप ज्वाइन होते रहिएगा, ये मेरी गुजारिश है आपसे।
जी
Pawan ji, next time not on Saturday.
No, not on. Today, World Unani Day is on today's birthday.
Morning. If it is Saturday in the morning, not in the afternoon.
No, not at
किसी
all.
को कबाब खाना होता है, किसी को बिरयानी खानी होती है, किसी को शादी भजन।
नहीं मैडम, सैटरडे है ना तो काम भी बहुत से निकलती है, हम लोग जानते हैं। और जब चावल वाली बात कह रही थी ना, वो हम लोग पकाते नहीं है असल में, लेकिन सही बात कर रही है।
बहुत खूब।
नहीं, इतना पकाने से अच्छा है ना, इतना कोई सर पकाने से अच्छा, जैसे डॉक्टर नफीस ने छोटा सा बस इतना सा बता दिया कि जहन में चले जाए। 5 मिनट से ज्यादा कोई सुनता नहीं है।
सही
5 मिनट से ज्यादा कोई सुनता नहीं, बस मुझे बोलना है, मैं बोल रही हूँ, मुझे वो नहीं करना। अभी मोहसिन भाई को मैंने कहा, मोहसिन भाई अभी काटती हूँ, 4 ही स्लाइड बनाती हूँ।
ठीक है।
You saw Dilek, she is like German. वो बाकायदा रिसर्च आर्टिकल पढ़ के पूछती है, ये क्या है, ये क्या है, ये क्या है, इसको ये कैसे करना है।
अरमान जी, हकीम जी फ्रॉम बांग्लादेश इज ज्वाइंड। और किसी नाम से आप हमारे साथ हैं क्या?
अरमान जी नहीं है, अरमान जी कबाब खा रहे हैं, टर्की वाले। He's really eating kebab. नहीं, वो सैटरडे इवनिंग है, वो सुबह से वो विज्ञान भवन वालों ने पका दिया जूम पे, वो चले गए, मैंने जाओ बोल दिया। पवन जी, I take your leave now. Thank you so much.
ऑल द बेस्ट।
बहुत अच्छा लगा आप लोगों के साथ। जज़ाक।
आप जुड़ते रहिएगा।
Thank you so much.
अग्निहोत्री जी नमस्कार, स्वागतम।
फ्रॉम पाकिस्तान।
वेलकम वेलकम।
थैंक यू, इतने दिनों बाद कभी तो मिलते हैं, और फिर आज उनके गेस्ट इंतजार कर रहे हैं, तो नेचुरली उन्हें जाना चाहिए, लेकिन उन्होंने कंक्लूड करके जाते तो अच्छा था, क्योंकि हमने ये पाया
रईस खान जी पाकिस्तान से हैं हमारे साथ।
आदाबर साहब, आदाबर। मैंने ये पाया कि आज हमारे जो यूनानी भाइयों ने जो अपना प्रेजेंटेशन दिया, अपनी साइंटिफिक अप्रोच दी, और जितने कॉन्फिडेंटली चर्चा हुई, मुझे ये लगा कि जितना यूनानी के ग्रेजुएट्स, पोस्ट ग्रेजुएट्स और हमारे आज के गेस्ट स्पीकर्स यूनानी पैथी के अलावे हमारे आयुर्वेद, योगा, सिद्धा के बारे में जानते हैं, हम उतना यूनानी के बारे में नहीं जानते। जबकि हमारे उत्तर प्रदेश में, इंडिया में आयुर्वेदिक एवं यूनानी सेवाएं करके जो डायरेक्टरेट हुआ करता था, वो कंबाइंड था, एवं तिब्बी मिला के। तो आज जिस तरीके से उन्होंने जो एक बात रखी कि हम अपने आयुर्वेदिक ज्ञान को, जिसमें विशेष रूप से मिजाज की बात आई, तो मिजाज को उन्होंने एट पार प्रकृति के माना, ऐसे लोक पुरुष की साम्यता बतलाई, त्रिदोषवाद बतलाया, सप्त धातुवाद बतलाया। तो इन सबको किस कदर को रिलेट किया गया आज के हमारे गेस्ट स्पीकर्स के द्वारा, तो इससे स्पष्ट है कि वो केवल यूनानी नहीं पढ़ते हैं, यूनानी के साथ साथ कंटेम्परेरी और पद्धतियां, स्पेशली जो पीछे चली आ रही हैं, those pathies which have got a very good strong historical background, say 5,000 years like that, and written texts are also available. In that sense, they are available with the such knowledge of the different pathies, and may well compare or correlate your existing Unani knowledge, since it has also traveled a lot of the different countries, the whole Yunnan and southeastern countries, etc. So that makes a amalgamation of the knowledge, which ultimately written in Urdu or this Farsi or this thing. So we are not going to have that much, nor the Hindi commentary is also available in such manner. While as of Ayurvedic text, though it is written in Sanskrit language, so many tikas and commentaries are there, which are very much helpful to know about the depth of the Ayurvedic sciences by the other persons. So what I found today, it was a great pleasure to us that Ayurvedic system of knowledge is being well understood by especially by the Unani persons, and it's a pleasure that we stand somewhere near to you with that near to your Unani system of medicine. Today, all the guest speakers very rightfully, very justicefully, very confidently, and with full knowledge presented their approach over the way we can be able to serve the masses, especially as they told that the means we are grateful to Moisenji and Professor Dr. G. Sofiji. These are the persons by whom contribution we could have started knowing something of Unani, with the view that Masra, Kasra, what are the other things. Otherwise, we were having a little bit some names of the Kushta Falad and this Sharbate Unnav and our Gazwa. These things were known. But the literary knowledge which is being given, that was really given by, I should say, an academician, the persons who are said to be the teachers, especially our both the fellow Nafiza Bano and our madam talked about things very deeply. So I feel thankful to all these guest speakers with their distinguished appearance and knowledgeful approach to our webinar. And we welcome, we thanks, we greet again the World Unani Day. Happy World Unani Day. May it live long and convey its knowledge to generations to come. And of course, if it can be simplified, especially for the availability in present era, it will again be more popular by the general masses. Because as we know, we have got 1,40,000 preparations of Ayurvedic preparations, but still we are having only 350 or 400 manufactured by the different manufacturing companies. And we are only 20, 30, we are using in a routine way. So goes the case with the other patches. So if the good preparations, which are commonly available, and of course not of must costly nature, are available, Unani will also serve a lot to the suffering humanity. With these words, I thank you all and send back the mic to Professor Pawan Sharma for the official concluding.
Thank you very much, sir. Thank you very much. Thank you, Nafiz Bano madam. Thank you, Claudia ji. Thank you, Rais Khan ji. Thank you, Nitin ji. Thank you, Momita ji. Thank you, Ashish Mishra ji. सभी को जोड़ने के लिए बहुत बहुत धन्यवाद. Really thank you by heart. Please do join. I am circulating announcements every day, and please do join every day. I am keeping one session, 3 sessions now booked. One for Madam Nafiz Bano, one for Vasudha, and one for Madam Amina Atharji. Thank you very much. So nice of you. Good night. Happy Unani Day. Thank you.
Good night to all.
Good night, right?